Did you know that the human body begins to show distinct precursors of approaching death several months before it actually occurs? Over more than 30 years of working with elderly patients, specialists have repeatedly observed such manifestations. This narrative will reveal signs that almost no one is aware of, but which can become a decisive factor in preparing for farewells or in the event of sudden loss. The first symptom to be presented is so common that the vast majority of people simply don't pay attention to it. However, once the true meaning of this sign is understood, it will become clear that the body is trying to warn of very serious internal transformations. Over years of extensive practice, a specific pattern of changes has been observed in the bodies of elderly patients when it becomes undeniable that their life journey is nearing its end. This is not about fleeting illnesses or tragic accidents, but about natural, sequential processes that activate as vital functional systems begin to malfunction. These changes follow an almost precise order, and understanding them can provide precious time for making key decisions regarding health and life. The most striking aspect is that such manifestations occur not only in critically ill individuals. Often, elderly people who consider themselves perfectly healthy begin to experience certain changes, unaware that their body is sending an important signal. Modern medical knowledge allows for the recognition of these signs, but unfortunately, this vital information doesn't always reach those who need it most. Today's goal is to break this informational silence and reveal exactly what you should pay close attention to in your own body or in the bodies of your loved ones. The first signal to pay special attention to is a gradual change in appetite. This isn't just about a reduced desire to eat. When the body begins to approach a critical state, it starts to conserve energy in a very specific way. The digestive system, which normally consumes about 20% of daily energy, gradually takes a back seat. This happens because the body, possessing ancient, instinctive wisdom, recognizes the urgent need to preserve resources for maintaining vital processes, such as the uninterrupted functioning of the heart and lungs. It's important to emphasize that changes manifest not only in a decrease in the total amount of food consumed. The type of food a person prefers also changes. Elderly individuals accustomed to refined and varied dishes begin to favor simpler, familiar foods. Some start consuming only liquid food, often in the form of heavily diluted soups, while others refuse solid food entirely. This is because the body enters a state where the digestion process becomes increasingly difficult. The stomach begins to produce digestive juices in smaller quantities. The intestines contract less actively, and the entire digestive system operates at the limit of resource conservation. From a scientific perspective, this is explained by the hypothalamus, a key part of the brain controlling hunger and thirst, starting to receive signals about problems in vital organs. In response, it reduces the sensation of hunger so that the body doesn't expend strength and energy on digesting food. Many anxious relatives try to force feed an elderly person, not understanding that refusal to eat may indicate profound and serious changes within the body. It is crucial to carefully observe whether changes in appetite are accompanied by other signs, which will be explained in detail. If readers have encountered similar experiences, they are encouraged to share them in the comments. This can provide invaluable help to those currently going through similar situations. However, there is another alarming symptom that often appears simultaneously with the loss of appetite. This signal usually emerges in sync with changes in eating habits. Yet, most people perceive it as an inherent part of the natural aging process. We are talking about drastic reorganizations of sleep patterns that occur when the body begins to prepare for its final stage of life. It's not just the duration of sleep that changes. Its rhythm transforms in a very specific way. An elderly person's brain begins to function on a new pattern, fundamentally altering the usual sleep-wake cycle. The reduction in melatonin production, a hormone regulating our internal biological clock, occurs not gradually, as in normal aging, but sharply and intensely. As a result, the person starts sleeping predominantly during the day and staying awake at night, leading to a severe disruption of the natural circadian rhythm. However, few are aware that with such sleep changes, the body takes very sensible measures to conserve energy. During sleep, the metabolic rate slows by approximately 15%, allowing the body to expend significantly fewer resources on maintaining vital functions. Therefore, extended sleep can be seen as a survival strategy that the brain employs, recognizing the critical importance of carefully managing every available drop of energy. From a scientific perspective, a decrease in the production of neurotransmitters like serotonin and dopamine significantly impacts daytime activity and alertness. When their levels diminish, the body instinctively seeks a state of minimal energy consumption, that is, deep sleep. Many families experience deep anxiety when an elderly person starts sleeping 18 or even 20 hours a day, unaware that this may indicate the body's strenuous fight to conserve vital energy. It is important to observe carefully whether there are difficulties waking up, confusion, or intermediate states between sleep and wakefulness. If you've already encountered this with loved ones, you undoubtedly know how difficult it is to experience. However, what will be discussed next is even more crucial for a comprehensive understanding of the processes occurring in your dear one's body. The third sign, which is strongly urged to be paid special attention to, is related to changes in skin and circulation. When the body begins to prepare for the end of its life cycle, it makes a very sensible decision. It directs blood primarily to vital organs such as the heart, lungs, and brain, while blood flow to the extremities significantly decreases. This means that the arms, legs, hands, and feet receive less blood, leading to the appearance of noticeable symptoms that you will be able to recognize. Firstly, you will feel cold on the skin of the hands and feet, even in warm weather. This happens because the heart, possibly weakened, is no longer able to effectively pump blood throughout the body. As a result, the extremities, being furthest from the heart, experience a lack of blood supply first. There are details known to few. Skin color changes in a very characteristic way. Nails may acquire a bluish or purplish tint, especially in the area under the nails, where blood supply is weakest. This bluish color, which specialists call cyanosis, is a clear sign that the blood is not sufficiently saturated with oxygen for all parts of the body. From a scientific perspective, this occurs because as the heart's strength and contractions diminish, oxygen circulation in the blood becomes less efficient. Venous blood, which is darker due to less oxygen, becomes more noticeable through the skin. In more severe cases, you may notice that the skin takes on a slight yellowish tint or even develops purple spots that are painless to the touch. These spots, known as livedo reticularis, appear because the small blood vessels of the skin receive an insufficient amount of blood. Many people do not realize that such skin changes can occur several months before more serious symptoms appear. This is like a quiet but persistent signal from the body, warning of serious internal changes. Another important sign is increased skin dryness, especially around the mouth and eyes. This is because the body retains fluid to maintain more vital functions. If you notice these manifestations in your loved ones, there's no need to panic, but be sure to consult a doctor to understand the situation. However, there are also more obvious signs related to breathing, which will be discussed next. One of the most characteristic symptoms, often unnoticed by relatives, is a change in breathing rhythm. This occurs when the lungs and the body as a whole begin to prepare for the end of life. Such changes often cause anxiety, but understanding their essence helps to cope with the situation and better support loved ones during this difficult period. It is precisely these nuances that will be discussed further. The heart's function becomes less productive. It is important to pay attention not only to shortness of breath, but also to very specific changes in breathing. The first respiratory symptom that appears is called Cheyne-Stokes breathing. This is an unusual rhythm where a person breathes with irregular intervals to ENUS. Venous blood, which is darker due to less oxygen, becomes more noticeable through the skin. In more severe cases, you may notice that the skin acquires a slight yellowish tint or even develops purple spots that are painless to the touch. These spots, known as livedo reticularis, appear because the small blood vessels of the skin receive an insufficient amount of blood. Many people do not realize that such skin changes can occur several months before more serious symptoms appear. This is like a quiet but persistent signal from the body, warning of serious internal changes. Another important sign is increased skin dryness, especially around the mouth and eyes. This is because the body retains fluid to maintain more vital functions. If you notice these manifestations in your loved ones, there's no need to panic, but be sure to consult a doctor to understand the situation. However, there are also more obvious signs related to breathing, which will be discussed next. One of the most characteristic symptoms, often unnoticed by relatives, is a change in breathing rhythm. This occurs when the lungs and the body as a whole begin to prepare for the end of life. Such changes often cause anxiety, but understanding their essence helps to cope with the situation and better support loved ones during this difficult period. It is precisely these nuances that will be discussed further. The heart's function becomes less productive. It is important to pay attention not only to shortness of breath, but also to very specific changes in breathing. The first respiratory symptom that appears is called Cheyne-Stokes breathing. This is an unusual rhythm where a person breathes with irregular intervals. Periods of deep inhalation are followed by sections of very shallow breathing or even its complete absence for several seconds. This happens because the respiratory center in the brain, which automatically regulates breathing, begins to receive confused signals about the oxygen and carbon dioxide content in the blood. When the heart cannot effectively pump blood, the brain receives less oxygen, which disrupts the complex system of breathing control. As a result, this irregular rhythm occurs, which can be very alarming and cause concern. It is important to understand that this change in breathing is not just a symptom, but a clear signal that the body is entering a mode of extreme resource conservation. From a scientific point of view, this is explained by the fact that the brainstem, where the respiratory center is located, is one of the last areas to be affected by systemic failure in the body. Even this vital area begins to experience oxygen deficiency. Such a sign indicates the body's strenuous struggle to maintain fundamental life functions. Another change in breathing that needs attention is increased respiratory rate. Even if the person is at complete rest, it becomes increasingly difficult for them to express themselves in full, coherent sentences. This happens because the lungs begin to work more intensely, trying to compensate for the decreased efficiency of the heart. Many people do not notice that these changes in breathing can manifest even during sleep. If you notice that a person makes unusual, interrupted sounds while breathing at night or experiences difficulty breathing when lying down, this could be a significant warning sign. The body, with its internal wisdom, tries to maintain oxygen supply to vital organs, but faces increasing difficulties. If you notice such changes in a loved one, it is extremely important to seek help from qualified specialists immediately. However, what will be discussed next may be even more unexpected as it relates to changes in consciousness and behavior. The fifth sign to report is perhaps the most difficult for families to perceive, but at the same time, one of the key ones for understanding the processes occurring when the body prepares for the final stages of life. This refers to mental and behavioral disturbances that arise as a result of reduced oxygen and nutrient supply to the brain. These changes are not limited to ordinary confusion or forgetfulness characteristic of natural aging, but represent specific disorders that develop in a strictly defined sequence. The first thing you will notice is that the person finds it difficult to focus on a conversation, even on topics that previously sparked their lively interest and active participation. This condition arises because the brain tries to conserve energy and gradually reduces its activity. It is necessary to prioritize the body's main functions, such as ensuring the uninterrupted work of the heart and lungs. Tasks requiring significant mental effort, such as processing complex information or prolonged concentration on something, become increasingly difficult. However, many do not suspect that these changes in thinking are not random. They occur in a specific order. Initially, the person loses interest in previously beloved activities, such as watching television programs, actively communicating with loved ones, or various hobbies. Then, problems arise with remembering recently occurred events, although memories from the distant past remain vivid and clear. This is explained by the brain conserving energy, retaining only the most significant and old memories, as they are stored more efficiently. From a scientific point of view, this is related to the hippocampus, an area of the brain responsible for creating new memories, which requires a large amount of energy when the body enters energy-saving mode. It is this part of the brain that reduces its activity first. Therefore, a person may forget events that happened just an hour ago, but clearly remember moments from their childhood. Another behavioral change that is often observed is social withdrawal. A person who previously enjoyed spending time with family and friends begins to seek solitude, speak less, and gradually withdraw from their surroundings. This condition should not be confused with traditional depression. Understanding and preparing the body for a natural transition phase is very important. Many families worry, mistakenly believing that the elderly person has become less desirous of their company. In reality, the brain redistributes all available energy to maintain vital functions. If you have had a similar experience with a loved one, please share in the comments. Now, signs that appear on the hands will be discussed, helping to understand what is happening in the body. These changes in the extremities can provide important information about the body's condition before death. We're talking about reorganizations that occur as blood circulation focuses only on vital organs. Note that the observed symptoms go beyond the usual sensation of cold. These are quite specific changes that develop in a certain order. First, you may notice that the hands and feet begin to swell, but this swelling is different from the usual. This swelling, which specialists call pitting edema, is not simply due to fluid accumulation, but because the heart experiences significant difficulty returning blood from the extremities to the main, vital parts of the body. If you press a finger on the swollen skin, an indentation will form and remain for several seconds, similar to a mark on yeast dough. This situation arises because the lymphatic system, responsible for effectively removing excess fluid from tissues, functions significantly worse. This particular point is extremely important for a comprehensive understanding of the processes occurring. Few people realize that nails also undergo changes, and they occur very specifically. They may become thicker, acquire a yellowish tint, or even begin to separate from the nail bed. This happens because the cells responsible for nail formation do not receive sufficient nutrients for full growth and development. In more severe cases, you may notice the rounding of fingertips, which is medically called clubbing. Scientifically, this is explained by the fact that with chronic lack of oxygen delivered by blood to the extremities, the cells of the fingers gradually begin to die. In response, the body tries to compensate for this deficiency by increasing blood flow to these areas, which ultimately leads to their swelling and characteristic change in shape. Another important change to pay close attention to: if there are difficulties in daily hand tasks, such as difficulty buttoning clothes or holding small objects, and a significant decrease in overall hand strength. This cannot be attributed solely to ordinary muscle weakness. Such symptoms indicate that the nervous system, responsible for fine motor skills and coordination of movements, is experiencing an acute lack of energy. Many do not even suspect that such changes in the extremities can manifest long before the onset of pain or serious discomfort. It is like quiet but persistent signals from the body, communicating important internal processes. If you notice similar signs in loved ones, do not ignore them under any circumstances, and be sure to consult qualified specialists. However, there are even more striking signs related to fluids in our body. Now, these will be discussed. The seventh symptom to report concerns changes in fluid excretion and stool characteristics. This topic often seems delicate and uncomfortable to many families, but it can reveal important details about the processes occurring in the body in anticipation of the end of life. These disturbances are not just ordinary bowel or urinary system problems, but specific dysfunctions reflecting the kidneys and intestines' response to the body entering a mode of maximum resource conservation. The first thing you may notice is significant changes in the quantity and color of urine. When the kidneys begin to work less efficiently, they excrete less fluid, which becomes highly concentrated, acquires a dark color, and a pronounced sharp odor. This is explained by the kidney's attempt to conserve moisture for the body, reducing water filtration and increasing fluid retention in the bloodstream. Few know that the color of urine can tell a lot about the condition of the kidneys. If it acquires yellow, intensely dark, orange, or even brown hues, this signals serious difficulties for the kidneys in filtering toxins from the blood. From a scientific point of view, this is caused by the fact that with a decrease in cardiac output, blood pressure in the kidneys decreases, which significantly impairs their filtration function. On the other hand, changes occurring in bowel function also play an important role. A person may experience severe constipation with no bowel movements for several days or persistent diarrhea. Such symptoms appear because the digestive system receives less energy and blood supply. As a result, the intestinal muscles function intermittently and irregularly. Very often, families do not realize that these stool disorders are directly related to circulatory system disturbances when the heart is unable to effectively pump blood. The kidneys and intestines are among the first organs whose work begins to falter and malfunction. In more severe situations, the patient may experience urinary or fecal incontinence. This does not happen due to loss of conscious control, but because the muscles responsible for the sphincters receive insufficient energy from the nervous system, leading to their weakening. It is also worth noting an important change. A person may naturally start drinking less water, even if actively offered. This is not a manifestation of stubbornness or refusal, but a response from the body, which understands that the kidneys are no longer able to fully process incoming fluids. If you're caring for such a person, it is extremely important to respect their dignity and seek professional medical help for a better understanding of the situation and to ensure proper care. But now, the most significant and perhaps the last signal from this entire narrative will be discussed. The eighth and final sign is arguably the most profound and informative of all mentioned. It concerns fluctuations in body temperature and the peculiarities of the body's thermoregulation. As life approaches its end, the human body faces increasing difficulties in maintaining a stable normal temperature of around 36 degrees Celsius, 96.8 degrees Fahrenheit. This inevitably leads to the appearance of characteristic signs that can be learned to recognize and interpret. The loss of the ability for effective thermoregulation is not just a subjective feeling of cold, but a deep, systemic change in the mechanisms of energy distribution within the body. One of the first distinguishing signs is that a person begins to feel chills even in comfortable room temperatures. They may require additional blankets or warmer clothing to stay warm. This phenomenon is explained by the slowing of metabolic processes, as a result of which internal heat is produced in significantly smaller volumes. It is noteworthy that at the same time, individual parts of the body, such as the forehead and chest area, may feel warmer than usual. This is due to the body redirecting remaining heat to vital internal organs. The most important aspect here is that temperature changes manifest unevenly, especially pronounced in the extremities. Hands and feet become cold to the touch, while the torso retains warmth. This sharp temperature contrast is easily felt upon touch. From a scientific point of view, this is explained by the hypothalamus, a key part of the brain responsible for thermoregulation, beginning to receive inconsistent and contradictory signals about the body's condition. If the heart muscle cannot cope with effective blood circulation, the brain interprets this as a critical situation and prioritizes heat conservation to maintain the function of key organs. Often, people are unaware that during these changes, the body's temperature imbalance is accompanied by intense night sweats. This phenomenon is not related to a feverish state, but represents the body's attempt to adapt to ongoing internal processes. The necessity of temperature control, which has gone beyond natural regulation, becomes obvious. In more severe situations, you may notice that the skin becomes moist and clammy to the touch, especially in the neck and chest area. All 8 symptoms revealed in this narrative are nothing more than signals sent by the body as it prepares for natural, inevitable changes. These are not harbingers of hopelessness, but rather indications that the body is following its ancient, naturally ingrained mechanism of adaptation and transition. Understanding these signs can provide precious time for making key decisions, having important conversations, and ensuring dignified care for your loved ones. If you notice some of these manifestations in a loved one, you should not panic, but rather seek professional medical help immediately to gain a deeper understanding of the situation. Remember, knowledge is a powerful force that helps you show love and care for the most precious people in your life.